Welcome, viewers, once again to this episode. And in this episode, we are going to talk about problems in the health sectors, and we'll talk about some of the causes and the effects of these problems. So, we will be looking at shortage or inadequate public hospitals in the country. So, we'll look at some of the causes of this and the effect it has brought upon the country. So, we are starting with the causes. So, Priscilla, what do you have to say about the causes of the inadequate public hospitals in Ghana?
For the inadequate public hospitals in the country, I think the government has invested very little funds in the health sector, because the health sector really needs a lot of funds, but it uses its funds for a lot of projects and it leaves the health sector behind. Because of this, we don't have a whole lot of things in the health sector. So I think it comes with inadequate funding from the government.
So because there is not enough money or funds to support the building of public hospitals, there are what shortage in them.
Yeah.
Okay, so Paps, what do you also have to say about the causes?
Okay. So far, I think one of the major causes that we have shortage staffing, where a lot of staffs are not, being equipped well, or they don't have so many people who are working. So if a lot of people are not working, you can't build
more hospitals because you don't get the
you wouldn't get people to be at each different sector for them to work at. Right.
Okay, so Echampama, what are you also saying about the causes?
Okay, so because of the insufficient funding and the staffing shortage, so it will cause brain drain, simply because if many skilled healthcare professionals migrate from maybe Ghana here to other countries, that their aim is they will get better healthcare system to operate on. So it will cause this brain drain in most of the health care centers in Ghana here.
So this means that because skilled professionals are searching for greener pastures in other countries where they will earn a better income, because of that they fail to work in the public sectors in the country and decide to go outside
the country.
Okay, so Mr. Emma, what are you also saying about the causes?
Well, thank you very much. I will also say poor infrastructure.
Okay.
You see, like nowadays, when you go to public hospitals, like their infrastructure are becoming outmoded, like, and they don't have the tools and equipment for the job. So you see, so it has made the place outmoded. So like if you go there, it doesn't look
it's not very attractive.
Yes, it's not very attractive to go there. So yes, so like poor infrastructure system is
one
a
of
big
the
problem that we are facing now in Ghana.
So we can also see that one effect is that the public sectors, most of the times, the government fails to put a lot of money into it so that we get more. Okay, so now what do you guys think about the effects of these causes? So now if I identify the causes of the problem, so what do you think about the effects?
There will be limited access in healthcare, because if the facilities are few and the government is not investing funds in it, one, because the people are not getting paid well because there are not a lot of funds, they will not have a lot of workers. So there will be limited access to the healthcare, because when people come, you will not even get doctors and nurses to take care of you, honestly. So there will be limited access. And then if the government brings about a lot of money, they can actually even build more hospitals for the public sector, so that it won't put pressure on the few that we have.
Yes, so if there is enough hospitals, it means the access to the healthcare service, it will no longer be limited, but it will be enough for everyone to get access to it. Okay, so
I can say that there is increase in healthcare cost. You see, because the public sector, like, is overcrowded and stuff. So you will not feel to go there. So like right now, people are running to the private hospital, and they are also into profit and stuff. So they charge a lot. So it has really caused the hurt.
Okay. And you can also say that even in the public hospitals, most of the doctors, because they are overcrowded, they use some means, that's protocol, so that if those who have money, they can pay some
You have to pay
amount,
so those who don't have meaning that you're stuck.
So if you don't have enough money to, let's say, bribe the doctors, you have to wait in the long line. But if you have money, you can bribe the doctors and you'll be taken care of.
We can even add bribery and corruption to this effect.
Yes. So this causes what? Corruption. Okay. So what other effect again?
Long waiting time. You see, if there is inadequate staffing and resources in the healthcare center, when patients come there, sometimes they delay their time in some of their diagnoses and surgeries because they don't have enough facilities, enough equipment for them to work for them, to heal them or something. So because they lack staffing and other resources, it will lead to long waiting time for the patient.
So this means that when you get to the hospital, you'll be seeing a lot of queue, or like a long queue, because there is limited facilities. Okay. What other effects can we also talk about?
Okay, just to sum it up, I can say that decreased quality of care. Okay, this is as a result where if you have few staffs working in the facility, when people come, gallivanting here and there, they are making sure that, okay, I have to treat these patients, I have to make sure that this patient
they're even in a hurry to work.
So people don't get that
enough
quality of care for themselves.
Okay, so I'm saying it means that the doctors or the nurses, they don't get enough time to diagnose the patients and sometimes prescribe medicines for them because there are many.
They are under pressure.
They can be in a hurry, just give from diagnosis and.
Okay. So finally, we have talked about some of the causes and the effect that is causing this problem. So we thank you for your time, and also we are waiting for your comments as well, so that we update next time in our episode. Thank you for joining us, and once again, subscribe to our channel. Thank you.